Hello, ladies and gentlemen, and everyone else in between. Welcome. As this is why you clicked on this video, I will explain the secondary survey. What is it, you may ask? Well, it is the survey that comes after the first survey. I know I'm not funny. A secondary survey is pretty much the assessment you do after rolling out any potential life-threatening condition your patient might have. If you're not sure how to do this, check my previous video about the primary survey and oh dear Bob. Before we continue, you know what to do. Click the like and subscribe for more weird but educational content. The secondary survey starts the same way the primary does, but instead of checking for danger and response, we go further to investigate any other medical condition or injuries. We know they're alive, and they hopefully remain alive for the assessment. So no rush. Take your time assessing and asking questions, focusing on one thing at a time. Let's go back to Bob. We are using Dr. ABCDE, but we need to take a few things off. No need to check for danger or response, since you've already done that. So airway. We know it's open and maintained because Bob is talking to us, and it's not blue. So what else? In this part, we can check how does the airway look like. Look inside the mouth and analyze what you see. Consider the oropharynx, tonsils, tongue, mucous membranes, teeth, and jaw. Check for any swelling, infection, burns, any signs of trauma, dehydration, deformities, necrosis, pretty much all that seems abnormal that could be an obstruction. After that, you check B for breathing. How is Bob breathing? To check this, you need to look at the rate of his breathing, inspect the chest, palpate to check any abnormalities, not because you're perf, percuss the chest, and auscultate, or otherwise ripper. I'm going to talk about this quite briefly and cover it in another video. If everything is fine, we move on to circulation. Quick tip: know where the pulse points are. Hang this picture on the fridge or wherever you stay the most and memorize it, as you will definitely need it in the future. Now going back to Bob. Do you know if he's bleeding from somewhere? Does he have any wounds? You should know this from your primary survey, since you've already exposed his skin and asked him if he had any. Please note that we're not talking about a trauma scenario, so open fractures, catastrophic hemorrhages, internal bleeding, and all that fun stuff will not be covered in this video, but probably in another one. Check central and peripheral pulses. Are they beating at the same time, same strength, same rhythm? Use carotid and radial pulse, for example, or both radial, but never both carotid. Bob oxygen to the brain might diminish, and he can faint. Check capillary refill. Press a nail for a second and see if the blood will turn to the nail in less than 2 seconds. If it does, the peripherals are well perfused. Also, don't forget to check the skin temperature. Like, do they feel warm to touch, or are they cold? The skin tone. Is their skin color looking normal to them, or are they a bit flushed, or yellow, or grey? As well as the texture of the skin. D is for disability. We are not checking the patient's eyes. Are their pupils reactive to light? You can use a pen torch and see if Bob's pupils react, or if they are of different sizes. Touching my inner poet, some say the eyes are the windows to your soul, but in fact, your eyes are the windows to your brain. The cranial nerves that supply your pupils are the optic nerves, which come straight up to your brain, so by shining a light onto the pupil and checking that the pupil constricts in the normal way, we can actually tell whether or not your brain is functioning properly. It doesn't tell us everything, obviously, but it's a bit of a clue as to whether there is something sinister going on in there. In bright light, your pupils become smaller in order to reduce the amount of light going into your retina, and wider in dim light to increase the light in your retina, so you are able to see. If they are equal, we call it pearl. Pupils are equal and round and reactive to light. At this point, you are able to check other signs of disability like AVPU and GCS. Even though you already done this in your primary survey, you should reassess as patients can become poorly in some cases and very quickly. We also assess the movement in the 4 limbs, the feeling in those limbs, and if they have pulses. We also check the FAST test or stroke test. FAST being face, any side droop, asymmetry, can use one side, speech abnormal or slurred speech, and test or time if you're not in a hospital setting. We can also check Bob's posture. Is he slumped to one side or unable to straighten his posture? Can lay down flat? Tripoding? All these are hints on how your patient is feeling and their conditions. And finally, check their mobility. Can they walk? Do they need help or equipment to move or walk? The last letter of our IBCDE is E. Expose, examine and evaluate. As the name suggests, expose the skin, examine any injuries and evaluate their condition. If you can't see it, you are going to miss it. So we have followed the structure of ABCDE. But now what? What else is missing? A lot, actually. Now you can relax a bit more. You know that Bob is fine, he doesn't need CPR, but he still has a medical issue that needs to be resolved. That's why he called you. To figure it out, do additional investigations, for example, check his vital signs like blood pressure, sugar levels, pulse oximetry, internal carbon dioxide, ECG or EKG, take a history, and do a head-to-toe secondary survey, which pretty much you start at the head, checking for any pain or tenderness, any sign of infection, burns or swelling or rashes, palpating their skin in order to pinpoint an injury or abnormality. But again, consent above all. Ask them if it's okay. Some people may not like it. Here's the normal values for a healthy adult. Feel free to pause the video or take a picture for future reference. You are welcome. Remember, my little students, think ABC. Assume nothing, believe nothing, and confirm everything. If anything changes, go back to ABCDE. Bob and many others are counting on you, and I know you'll deliver. Thank you for watching this video, and I hope to see you in another one.